So my name is Marty Mascari. I want to welcome you all. I'm with the North Central Texas Area Agency. Oh, wow, let me do this first. That's terrible. How rude of me. Good morning. I'm so sorry. We'll start again. Good morning, everybody. My name is Marty Mascari. I am a contractor with the North Central Texas Area Agency on Aging and the North Central Texas Aging and Disability Resource Center, both of which are under the umbrella of the North Central Texas Council of Governments in the greater Dallas-Fort Worth, Texas area. We are blessed to have my cohorts with the Area Agency on Aging, Melinda Gardner and Felicia Warner, and Angel Hanzik. Is that right? Hanzik. I don't. And Angel Hanzik is with the Better Business Bureau Foundation, Houston chapter. And we're going to be talking about Medicare Plan Finder and when Medicare, quote, quote, calls for phone scams. And so before we get started, if I could get you, there we go. We're going to talk about CEUs real quick. For those of you that are joining us that are looking to get CEUs today, we are set up to offer CEUs for licensed social workers and licensed professional counselors within the state of Texas. We also offer a certificate of attendance. The guidelines are the same for both. Just so you know, we're set up for the LPC and social work in Texas. I've had people with other licenses in Texas or people with licenses outside of Texas that have gotten the certificates and said they could use them, but there's no guarantee. In order to get the certificate, you would need to complete the entire live webinar and Q&A. It's worth 1.5 hours of CEU credits. And then you must complete the Google evaluation survey. It should give you an option to go to that as you close out of Zoom today. And if it does not, you'll receive that in a follow-up email as well, that link to complete that. You'll have 1 week, a little over a week to complete it, or I'm giving you till next Friday because I probably won't get the follow-up out till tomorrow. But you'll have 1 week to complete that. And then if you give us about a month to get those certificates out, it takes a bit. So that is all for me. And I'm going to turn over to Melinda Gardner and let her introduce Angel, if she would.
All right. Thank you very much, Marty. And thank you for coordinating these midweek Medicares. They have been helpful. I've received feedback from people. So I'm glad we are partnering, especially with the Better Business Bureau Education Foundation, to provide important information about Medicare scams. So I am going to let Angel provide information about Medicare scams.
Awesome. Thank you permission. So much. All right. So I'm in charge now. I can move my slides.
You should be able to.
All right. Beautiful. Good morning, everybody. Thank y'all so much for having me here. I am Angel Hanzik. I'm the Senior State Project Coordinator with the Texas Senior Medicare Patrol, which is a program under the Better Business Bureau's Education Foundation. And today we're going to be talking about when Medicare calls, aka phone scams. Feel free to go ahead and put any questions you have in the chat or in the Q&A function, and we'll get to those at the end. All right, let's go ahead and get going then. Mayhaps. Okay, there we go. So who is the Texas Senior Medicare Patrol? So we are a federally funded program housed in the Better Business Bureau Education Foundation. We are specific to the state of Texas, but there's one of us in every single state and all the U.S. territories. Okay, and what we actually do is we recruit and train professionals and volunteers on Medicare fraud and abuse so that they can go out in the community and share that information with others and hopefully prevent more scams from happening. We also are a reporting agency, so you can actually call us and report any Medicare or healthcare fraud that you're experiencing. We actually build a case with you and send it to the correct Medicare fraud control units. So we like to say we're a one-stop shop for Medicare fraud. Okay, so our mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, error, and abuse through outreach, counseling, and education. So, beautiful way to say we talk about healthcare fraud. So, what do scammers actually want? Okay, and feel free to throw in the chat if you have any other ideas, but money, of course. They want our money. quick and easy. But gift cards are also great, you know, because gift cards are untraceable. Once you put that money on it, you can't get it back. And they can't track where that spending is going. Obviously, they want our credit card information, our bank account information. They want access to where they can get that money, right? Also, our social security number or our Medicare number. A lot of us don't realize that our Medicare number can be stolen in a similar way our social security number can, that we have a medical identity that can be stolen and misused. Our date of birth. They want some of our information, our personal information that they can use for security questions or guessing passwords. A lot of us use our mother's name, our children's names, our birthdays, important dates as passwords or pins for a lot of our private information. And also our time. They want to chat with us. They want to have our time. They want to chat with us and manipulate us and build a relationship with us so that they can get access to these other things. Okay. And so here are some red flags whenever we are talking to someone. We're not quite sure what organization they're from, who they're calling for. So these are those red flags, something that should immediately pop up for us. If someone has extreme urgency, you have to do something in the next 24 hours, you have to do it today, you have to give me that information right now, or else there will be severe consequences. Right? So those are those scare tactics. They're going to threaten us. You're no longer going to have health benefits. The police are going to come. You're going to have to owe more money. Okay, so just really threatening energy, very quick urgency, asking for private information over the phone. A lot of organizations is not going to ask for this private information over the phone. That should be an immediate red flag. Asking for your social security number, bank account information, passwords, all of that. We understand that sensitive information and we're not going to ask for those things over the phone. Okay. Or if they're calling from a private number or something that's unavailable, so we don't actually know where they're calling from, they should set up some red flags for us. So number one scam that we see, and I know that every single person, if you have a phone, you're experiencing spoofing scams. So spoofing scams, this is whenever a scammer actually uses a software to manipulate the number on your phone as it shows up in your caller ID. Okay, so this is not your contacts. They're not manipulating your contact list, but they can make that number show up that they're calling from to look as any number in the world. So I have a 979 area code, but I could use one of these softwares to actually look like I'm calling from 1-800-Medicare. Okay, so that is how they manipulate and try to pretend to have some legitimacy. Okay, because we're more likely to answer a phone call from a number like a 1-800 number or a local number to us. So this is a big one, is spoofing scams. So just because it looks like a certain number is calling, it looks like a certain area code, that doesn't mean it's necessarily true. We really encourage you, don't answer that phone call. Just let it go to voicemail if they're not saved in your contact list. Okay, which brings us to our next one, which is government imposters. So this is a list of organizations that are never going to call you. And feel free to throw some other ones in the chat. But scammers will pretend to be authority figures or representatives of legitimate organizations to try and get you on the phone and get you to share that information. So organizations that are never going to call us. Medicare is not going to call. Medicaid, the IRS, Social Security, the Federal Trade Commission. These are all organizations that are not going to call us. They're going to use perhaps email and definitely snail mail, those letters in the mail. That's how they're primarily going to be contacting us, not through urgent phone calls asking for payment information or your Medicare number or Social Security number. Okay, if anyone claims to be from any of these organizations, first thing you want to do, just hang up. Don't share any of that private information over the phone, and don't be afraid. Next, a really common scam that we're seeing right now is the grandparent scam. Okay, so this is whenever we get a phone call from someone claiming to be our niece, our nephew, our grandchild, and they're calling and saying, "Grandma, Grandpa, I am in trouble. I need this money. Please help. I've been kidnapped. I'm in prison. I need $500. Don't call my mom. Don't call the police. Don't tell anybody. Just send the money here." Okay. This can be really terrifying, right? Because we never know what our family can get into. But it's really big right now, especially because of AI, that artificial intelligence. we are seeing a lot of voice cloning softwares popping up. So we're all over social media. Our voice is on our voicemail, on our Facebook, on Instagram. And so these voices can actually be recorded and cloned so they can mimic our voices whenever they're calling our grandparents or our loved ones, claiming to be us and asking for that money. So we ask that you please consider using a family code word. Have a family meeting, say, this is how you're going to know it's me. Okay, our code word is pineapple. If I say pineapple, I'm really in trouble. It's really me. Okay, and if anyone is asking you to send money or to buy gift cards, okay, this immediate red flags. First thing you should do is check on that family member. Call them directly. Okay, because 9 times out of 10, they're going to be sitting on their couch watching Netflix. Okay, not in some random prison or stuck on the side of the road. So please check with them directly first. Also, say yes scams. This is a really big one. I'm sure a lot of us have heard of this, where a scammer will get us on the phone and they're actually recording this phone call as we're going, and they're trying to get us to say yes. Okay, they're trying to get us to confirm in one way or another. So they might say, hello, is this Mrs. Jones? Yes, this is she. We want to really stray away from this because scammers are recording these phone calls and may use that yes, that verbal yes, and use it in a different context to seem like you're actually consenting to something that you're not. Okay, so please consider maybe doing, how can I help you? What do you need? This is Angel, things like that if you're unsure. But also the best thing to do, don't answer and just hang up. Okay, just consider hanging up. So just be wary of that whenever we're answering the phone. We have phishing scams. Okay, so this is whenever we're getting that email or that text message saying there's an issue with your bank, your package can't be delivered. We need you to verify this information. The big one that we see right now is those text messages from USPS saying your package is undeliverable. Here's your tracking number. You need to confirm something. Click on this link. Okay, so this is phishing scams. They don't know if you actually use USPS or if you've ordered anything recently, but they're sending out a line, right? They're casting a wide net and they're hoping someone takes the bait, AKA phishing. They're fishing for someone to take the bait. And so what I really encourage you to do, don't click on any links. Don't download anything. If you don't know who it's from, don't click on it. Okay, because this will just get a virus on your device, or it will take you to a false website where you'll put in your information. It'll look like it's actually Amazon.com, but it's not. And you'll put in your information, and now that's how they have your passwords, is through that false website. So please be wary of anything for those urgencies or anything from an unknown number. Just delete it. Okay, it's not even worth your time. Okay, and if you're not sure, go verify on the actual site. Actually go to your Amazon account or go look up USPS and look up the actual tracking number that you have for whatever you've ordered, if you have even ordered something. Next, we have tech support scams. So this may happen if we go on a website and we see those little pop-ups that say, we've detected a virus on your device. Okay, and they're asking you to click here, download this service, use this tech support, and we'll go ahead and take this virus off. Don't worry, we've got it. Except that's not how that works. Okay, tech support is not going to come to you if they believe that there's an issue on your device. It's the same way the plumber is not going to knock on your door and say, hey, I think you have a leaky faucet. You have to call them and let them know, hey, I'm having an issue. There's no way for them to know what's going on in your device. So please, please be wary of any of those random pop-up ads. Don't click on them. Don't just let any person have remote access to your device. Okay, that's something that we really want to be wary of. Anyone who's soliciting us, that's a red flag. Anytime that we need a service, we should be going to someone, not someone coming to us. Okay, so probably stick to your Geek Squad at Best Buy or doing your research, okay? but don't just trust anyone who sends you an email or any ad that pops up on your Facebook. Okay, next we have money mule scams. So right now we are in the age of online money apps. So we've got Venmo, Cash App, Zelle, all of these fun ways to send money, but they're actually being misused by scammers. Okay, so what is happening is they are actually sending out these big payments, $100, $500, $1,000 to random people. Okay, so they're sending this money out and then saying, oh my gosh, I'm so sorry, I sent it to the wrong person. Will you please send it back? And so, of course, we're all good people. We're like, oh no, you sent money that wasn't for me. Yes, I'll send it right back. What this is doing is actually, it's a money mule scam. So they're sending this money around to lose trace of it. And so they've sent over fraudulent money, right? So that's going to get denied. You send back that $500, that's 500 real dollars, you know, from your account that is now going into theirs. And so now it's created this trail that is unfollowable. And so now they're actually getting real money in their account. So if someone sends you some random large amount saying, oh no, like I wasn't supposed to do that, so sorry, and you don't know them, this is an unknown sender, do not send it back. Do not touch that money. Just leave it there. If they have an issue, if they actually genuinely sent it to the wrong person, they'll contact support, not us, right? Not us random people that they just sent $500 to. So if you do receive anything like this, please, please, please ignore it. Don't use it. Don't mess with it. Don't send it back. And then after a while, maybe you did just make $500. Who knows? But that's what we really encourage is don't send it back. Okay, of course, social media is being misused by scammers. The really big one that we see is romance scams or catfishing. Okay, so when someone will create a fake profile online, make a fake account for themselves and start developing relationships with people. So one that we may see is someone pretending to be Brad Pitt or some other famous individual, reaching out to someone, hey, you're such an amazing fan. You've been such like a great fan. I really appreciate all of your support. I want to take you out on a date. You know, I really want to get to know you, but my money is tied up in these foreign accounts. I can't fly out. Can you send me $500? I'll get a plane ticket and I'll come see you. Okay, things like that. Or pretending to be an army general overseas. Okay, these are all very common things that we see. So whenever we're getting these messages out of the blue, okay, people just coming out of nowhere trying to build relationships with us, let's do our research. Let's look at their friend lists. Let's see if they actually have groups of friends. Let's look at their post history. Is it all just ads? Is it random things? Do they have people posting for their birthdays, you know, for actual events? So, and ask your other friends. Ask your friends, hey, do you remember this person? Do you know Bob from high school? Somebody just messaged me. I don't know who this is. Okay, just do your research if you're not sure. And also, don't respond. Just delete. That is the best thing you can do. If you're not sure, just don't even interact with it. Okay, it's just opening up a whole can of worms. If you believe that you are a victim of Medicare fraud, if we're getting those calls from quote unquote Medicare, which remember, they're never going to call us, you can check your Medicare summary notices or your explanation of benefits, okay, every time that those come out, and make sure that our Medicare number is not being misused, okay? Look for double billing, okay? Look for those double charges, any services that are charged on there that were never provided, or if you're being charged for more than that code should be. First thing you want to do, call your provider. It may just be an error or a mistake, okay? They should be able to get that cleared up. And then go ahead and call the Texas Senior Medicare Patrol. That is us, okay? And we can help build that case and walk you through it and hopefully get that taken care of. If you're a victim of any other type of fraud, any of the frauds listed here today, or any other scams, you can report it to the Better Business Bureau's website at bbb.org. We have a scam tracker there, but also we really encourage you to contact the Federal Trade Commission and report it there on their website, reportfraud.ftc.gov, or at their hotline number. Okay, that is the only way that we know what is going on in our communities and what's happening on the streets, so that these fraud control units can build task forces that actually target these fraud cases. Okay, so please, please, please do report. And now I'll go ahead and open it up for questions. So if you have any questions, please put it in the chat or in the Q&A function. Let's see.
Let's see. I don't see any in the Q&A.
Virginia asked, how do you stop or block a solicitation call?
Okay, so that is a great question. That's what everybody wants to know, right? So the one thing that we can do, that we do encourage, is put your name on the do not call list, the National Do Not Call Registry. You can do that online. You put your name, your phone number, and your email, and that should take you off of all of those marketing calls, right? But that's just telemarketers. And so that's maybe 5% of all the calls that we're getting. But you can put it on there and take that off. And then for all the other scam calls, which there's a lot, the best thing to do not answer. Do not answer. Just let it go to voicemail, because eventually they're going to stop marking your number as live, right? Every time we answer that phone and it's a scammer, they mark that we're a live line and they sell our number to other scammers. And so that's why we're getting so many calls. So the best thing we can do is just don't answer. And I know that's really tough for a lot of people. I know it's hard for me because you never know who's calling. But real people will leave you a voicemail. Scammers don't. That's the best advice we got. Also, I see Danette said, for social media scams, we'll get those messages. You've just won a new power drill. We're Amazon customer service. You got a new phone. All of those things, absolutely yes. Anytime someone is offering something for free, saying you want a free prize, unfortunately, not a lot in this world is free. If anybody is saying you want a free anything, it's most likely a scam. Just go ahead, ignore it, delete it. Okay, well, if there's no other questions, I'll go ahead and I'll turn it over to Miss Melinda and Miss Felicia, and y'all can feel free to send me an email, give me a call, or put something in the chat, and we'll get to it later.
All right. Thank you very much, Angel. That was great information. And I actually had a call the other day from someone who says the billing manager at a doctor's office had worked at like 2 or 3 other doctor's offices. And I guess she's following them around, I guess. I don't know. But she was saying that they were charging her for a visit, even though she has Medicare and a Medigap Plan F. And I did give her the number for the Senior Medicare Patrol. So I do hope that she called to get that straightened out and taken care of, because it seemed to be one individual. So hopefully that was taken care of. And I know it does take a while sometimes to build these cases, but Senior Medicare Patrol does a great job. And we've seen some people that were indicted. And so, yes, it works to report it. All right. And Angel mentioned Medicare will not call. That is true, but I just received an email that they're going to start doing surveys. But it's actually a different company that will be calling. So we will provide more information about that next month. So make sure and join us for next month, so you know, if you are a Medicare beneficiary, you will know what to expect for something like that. All right. All right. Normally we present first, so I'm going to welcome everybody again. Thank you for attending. We are the North Central Texas Area Agency on Aging, and our agency covers the North Central Texas area. We are part of a national organization called SHIP, State Health Insurance Assistance Program. And if you are not in our service area, you can actually call the toll-free SHIP number or go to the shiphelp.org website to find a SHIP in your area. We are, Felicia, myself, and Simon are the core benefits counseling team. We have a couple other people that assist us that are benefits counselors, as well as volunteers. So if you are interested in helping us, we would love to have you, and you can contact us for more information about volunteering. The State Health Insurance Assistance Program provides local, unbiased, confidential, knowledgeable assistance. And we can do that by telephone, we can do that in person, or we can do it virtually. We also have on-site clinics in some of our service areas, so you can actually visit with someone face-to-face. And that's why we also started the virtual, because then that is a face-to-face also, and it helps people feel more comfortable. So what we will be discussing today, we're going to provide an overview of Medicare updates, and then we're also going to provide additional information next month. We're going to give you an overview of Medicare prescription drug coverage, how to effectively navigate the Medicare Plan Finder, teach you how to evaluate Medicare drug plans, and then highlight factors to consider when using the Plan Finder tool. And we're going to give you some pearls. We're going to provide Plan Finder tools that will help you when you're using the Plan Finder. So watch for that pink star. All right, this provides a little secret. If you have a Medicare and You handbook, then on the inside cover provides information about updates for the upcoming year. So this is very good information. It does provide the updates and gives you a page number to get more information. So this is very helpful, especially for those that actually anyone on Medicare or those just starting Medicare. The important thing this year we're going to talk about is the limit on prescription drug costs. So we'll get into that in a little bit. All right, well, we already know Medicare Part A and B, those costs change each year. So Part A deductible has gone up, as well as the additional hospital copays, the skilled nursing facility copay. But Part A monthly premium, which only affects a small portion of individuals, that went down by $1. So that is something that went down. And then the Part A monthly premium for people who have 30 to 39 credits stayed the same. Part B actually went up. The standard monthly premium this year is $164.90. And next year it's going up to $174. Actually, it's $174.80. I apologize for that. The Part B deductible is going to $240. And this year it was $226. And on the next slide, we're going to talk about the income-related monthly adjustment amount. So if someone has income higher than the $103,000 for an individual or $206,000 for a couple, then they will pay a higher monthly premium based on their tax return from 2 years prior. So for 2024, it's based on the 2022 tax return amounts. In addition to Part B IRMA, income-related monthly adjustment amount, Part D also has an income-related monthly adjustment amount. So again, those income limits are the same, and what you pay is in addition to the monthly premium, depending on what that income is for an individual or for a couple. A new category that started, I believe, a year or two ago is Part B ID benefit, and that is for anyone that is post-kidney transplant and they need immunosuppressive drugs, which everybody does. This benefit, or this Part B ID benefit, the monthly premium is less than the standard premium. And the late enrollment penalty would not apply if someone chooses to enroll in Part B. And if someone has limited income and resources, they may still qualify for the MSP, Medicare Savings Program. If they have a higher income, then that income-related monthly adjustment amount still could apply to them as well. This update is for our standard drug benefit from 2023 to 2024. As you can see, it is gone up. However, there is something that has decreased. So if someone takes expensive prescriptions, or maybe they take a lot of prescriptions, if someone reaches the catastrophic coverage period, then there will be no cost sharing during that period. So prior to this time, they would pay anywhere from $5 to $10, but now it will be zero cost during the catastrophic coverage period. So anyone who is on low income subsidy or anyone who is not will have that benefit during the catastrophic period, no cost. If someone is receiving low income subsidy or extra help, now there is only full extra help. There's no longer partial extra help, so that will reduce the cost of the prescriptions as well as the monthly premium. And as you can see on the slide, the full subsidy copays are increasing slightly for 2024. And if someone is enrolled in a Medicare Advantage plan, there is a maximum out-of-pocket for these plans. And usually there is an in-network out-of-pocket limit. If it's an HMO, if it's a PPO, then you can go in or out of network, and that has a higher maximum out-of-pocket limit. And these apply to Part A and Part B services only. It does not apply to prescriptions. All right, here's some more good news. This year, the insulin prescriptions, they have been capped at $35. Some of the prescriptions may not have been capped for this year, but next year they all are capped at $35 as long as they're on the plan's formulary. So if for some reason you are taking insulin and your cost is higher than $35, then check with your plan. It's possible you have a prescription that is outside of their formulary, but there may be an alternative that you can take. Next year, we talked about that catastrophic coverage. That's going to eliminate that 5% during that coverage period. And if someone is on low income subsidy, that again will, the full subsidy has been, the partial subsidy has been expanded so that now everyone will have full subsidy. And then in 2025, prescription drug costs will be capped at $2,000 per year. That is huge. We don't have any additional information on that right now of how that's going to work out, but that is coming in 2025. So I look forward to seeing what that looks like, because that is a huge help for beneficiaries. And then in 2026, Medicare is going to negotiate some more costs with the drug manufacturers for some Part D and Part B drugs. So they are looking at lowering the cost of prescriptions so people don't have to decide if they should eat or if they should take their prescription. So these are things that are happening because of the Inflation Reduction Act. And I look forward to seeing what other ones will be, what other benefits will happen in the coming years. So that's just a snippet of the Medicare updates. Again, we'll be going over more of those next month. And I'm going to turn it over to Felicia to provide us information on the Medicare Plan Finder tool.
Thank you so much, Melinda. Good morning, everyone. Oh, I'm excited about the changes that are coming through. It's going to be a big help to so many of our Medicare beneficiaries and their families. So let's start with the Medicare Plan Finder tool. And we'll go to the next slide. I'm excited about this because finding a plan, as it states, has never been easier. It really hasn't. And I use this myself daily throughout the workday to help people find the best plan for them and help them save money. So the Medicare prescription drug coverage, you have a Medicare prescription drug plan through your Medicare Advantage plan, or you have a standalone prescription drug plan. But you can't have both of them at the same time. So when this is added to a traditional Medicare, you usually get a standalone prescription drug plan. So we'll go to the next slide. And this is added to traditional Medicare. So when you have original Medicare, which is sometimes called the traditional Medicare, you have a standalone prescription drug plan. But when you have a Medicare Advantage plan, your prescription drug plan is often bundled into that. So just be aware of those two ways to get your prescription drug plans. And of course, you must have Part A and Part B to join a prescription drug plan. And you cannot have a prescription drug plan added to a Medicare Advantage plan or special needs plan. So the lowest, in 2023, the lowest prescription drug plan in Texas was $6.06. So we have some new ones coming up, and one, I was really shocked to see it. It was 50 cents. So we'll take a look at that, and we'll just go over completely the Medicare Plan Finder. And I think you'll find it a very exciting tool to use. Medicare Advantage plans and prescription plans, almost 90 plans are in the North Central Texas area, and that's a good thing. Each county may have different plans available, ranging from 16 plans in Palo Pinto County to 56 plans in Collin County. And that's a difference between the rural areas. Often there's not a lot to choose from, but they have 16 plans. The prescription drug plans, and there are 22 plans, each which are available throughout the region. Prescription drug coverage. Most beneficiaries need to actively sign up for your Medicare prescription drug plan. And often if you do not sign up on time, or you can face late enrollment penalty. And there are some exceptions if you're Medicaid or low income subsidy recipients, or those who have credible coverage from their employer. And some employers or employer benefits or union programs, whether it's VA, TRICARE, or any of the others. So from this little chart, and I'm not going to go into too much, you can see how in 2007, how the standalone prescription drug plans were available compared to the Medicare Advantage plan, and how in 2023, it somewhat outpaced them, the Medicare Advantage drug plans. And special enrollment periods, you can move out of your plan service area and you would be afforded a special enrollment. Or you have Medicaid and you qualify for extra help. You live in an institution or like a nursing home, or you can have the 5-star special enrollment period. Anytime you're still covered, but during your 8-month period that begins the month after the employment ends, or the coverage ends, whichever happens first, you have a special enrollment plan, joining, switching, or dropping a Medicare drug plan or Medicare Advantage plan. And initial enrollment period, you can join a Medicare drug plan when you are first eligible. And we always encourage people to do that. And you recall those exceptions if you have credible coverage from your employer and you want to continue still work. And we are now in open enrollment, and that is between, of course, started October the 15th through December the 7th. And we always encourage individuals to take a look at what they have and check and see what their plan is covering for the upcoming year. And you can join or switch a Medicare drug plan, and that coverage will begin January the 1st. And again, we talked about the special enrollment period. So retired or employer coverage ends, you've moved, you're dual eligible, extra help, and you can change over to a 5-star plan, 5-star plans. Medicare Advantage open enrollment, and it's from January 1 through March the 31st of each year. And you can go from a Medicare Advantage plan to another Medicare Advantage plan, or you can go from a Medicare Advantage plan back to an original Medicare with a prescription drug plan. And healthcare service menus, if you are going to if we're helping individuals make a choice. So this is where the Plan Finder tool comes in so handy. And I get so excited. I just go kind of crazy because this is the Medicare landing page. And it is so much easier to use. You can find your health plans, your drug plans, you can find providers, but we're just going to stick with the drug plans for right now. I encourage everyone to explore this website. And of course, the little arrow says click there to learn about our fine health and drug plans. And this, you start your search. We encourage everyone to start or create a Medicare.gov account. And we're going to talk about that more because that will give you that personalized service when you are in the Medicare.gov website. So you start by putting your zip code in that little box. And then you can search for Medicare Advantage plans, prescription drug plans, or Medigap plans. It's so much better than it was before. And that is where you would find, but I don't believe that's still available. So we'll go to the next slide. And it'll ask you about your costs. Do you get help from Medicaid? Do you get help from extra help? And if you're not sure, and then you can click on, I don't get any help from those plans. And then it'll help you start your search. And of course, it'll ask you, tell us about your preferences when you're joining a plan. And then you'll enter your prescriptions. You can put in the amount, the quantity, and it will all come up and it will be added to that list. And that will help you find your pharmacies. And it'll make sure that you have the right amounts in there. I'm sorry, you need to make sure you have inputted the correct amounts and dosages. And then often if you put in a brand name drug, it will tell you if your drug has a generic component. And you can choose if you want to keep the brand name, you can, or you can have the generic. It's just your personal preference. Then we'll go to the next slide. And of course, this is tell us about this drug. Well, albuterol. And you'll put it in there and it'll show the name and it'll show the package and the quantity and the frequency. And you just click on that button and just add that to your drug list. And of course, over-the-counter drugs cannot be added. And we've had individuals tell us that the doctors told them to take vitamin B12 or some other type of vitamin, but that is an over-the-counter drug and Medicare does not list that. So after verifying all of your drug information and that it is correct, click on the button that you are done adding drugs. And the pharmacies. We encourage when we are doing a prescription drug plan, using the plan finder, that you do choose up to 5 pharmacies in your area. And they're all listed on the page when you have, and your zip code will show up. And right there, you have zip code. And then it'll show the surrounding pharmacies in your area. When you find a pharmacy, select to add it to the blue bar down at the bottom. The blue bar shows the pharmacies that you have currently selected, and you can remove those just by clicking at the top on the X, and you can add another if you choose. So it's just really your personal preference. And also, if you're unable to get your prescription and you're at home with a cold and the doctor's has called in a prescription for you, and it's convenient for your family to go to a pharmacy and pick up your medication for you, that can be a help also. That's the blue bar. We'll go on. And it'll ask you the plan type. Is this a prescription drug plan or a Medicare Advantage plan? So we encourage you to use the filters, and we'll get into that also. And there's also some more information that there's the plans that are available in your area in the top right-hand corner. And it'll also show your location. And you just want to make sure that's all correct. And the plan type. and also, again, the plans. It's so many features. It's like I think of going on Amazon and you use the filters to just throw out the trash that you don't want, and you don't want to look through every page that's there. So you just want to refine your search, tailor it to your needs. So we have plan sorting. So the first one that comes up is Blue Shield RX Enhanced. So you can see that the monthly premium for this is $172.50. It'll show you your retail pharmacy, the mail-in pharmacy, your deductible, and on the right-hand side, your pharmacies, and of course, the drugs. And we'll go to the next slide. And then again, you can sort the plans. The first one that comes up is the lowest drug and premium costs. So if that's important to you, you can leave it there, or you can go, as we go to the next slide, you can change it and tailor it to what you need. If it's the lowest monthly premium, if that's important to you, then you would click on that. And the plan results. And then you will be able to see more details. There is a button to enroll if you choose after you've looked through the plan and the plan details. And so we're just going to dissect the plan finder a little bit. We know that the general search starts with the lowest cost retail plan, and it's listed first. And then the next is if you have created an account, and you get that personalized search because it's going to save your information for you. All plans are listed from the least to the most expensive. So as you go down the page when you're on the plan finder, you'll see that first one is the least expensive. And if you scroll through the pages, it will be more expensive as it goes on. But don't stop there. Just keep looking to find what is important to you. And often, and sometimes the beneficiary's current plan is the least expensive, but you just want to make sure by continuing to do your research. And that's a pearl that Melinda mentioned. And so we have the total drug and premium costs. So it just outlines everything that is there. This plan is monthly premium is $172.50. And it's the retail pharmacy and the mail order pharmacy. And you can see by that red box, this tells you the retail pharmacy. If you go to like CVS or Walgreens, that it'll show that there. That's the retail cost. If you use the mail order, it's a little bit cheaper, and that's the estimated total drug and premium cost. So always keep in mind that, and I'm sorry, go to the next slide. All this information includes your yearly premium, your annual deductible, your drug costs before the gap, and I'm sure we've all heard about the gap, the drug costs during the gap, and the drug costs after the gap, catastrophic coverage phase, and cash costs for any non-formulary drugs. And it just states really the total out of pocket. That's out of pocket what it's going to cost you. So the plan details for this plan, Blue Shield RX Enhanced Prescription Drug Plan, PDP, again, it's outlining exactly what is available with this plan. And you can enroll or you can look at the plan details. And we always encourage you to look, as it highlighted in red there, at the plan details. And your pharmacy network, which is, we're going to talk a little bit more about your out-of-network pharmacies, your preferred pharmacy, and your in-network pharmacies. And some important details about that. We'll go to the next slide. And in the red box, you can see out-of-network pharmacies. And you really don't want to go there because it's going to cost you more money as your in-network and your in-network preferred pharmacies. And I'll explain a little bit more on the next slide. So there are financial incentives, not only from the plan, but thinking of your pocketbook, your wallet, what's in your wallet. This is a group, a contracted group of pharmacies that provide incentivized rates to a plan, thereby lowering the costs for the plan and the patients. Pharmacy contracts with the plan, and you can receive lower reimbursement rates or increased volume of business, and by using in-network pharmacies, but most important, use your in-network preferred pharmacies. And to avoid those higher copays on your prescriptions and access that you need, and it's going to show you the distance from the pharmacy, so 5 miles, 10 miles. And so it just kind of makes a difference. So we'll go to the next slide and discuss costs. Drug costs via pharmacy type. So here's a list of medications that they provided for us here. And just remember, this is California. They've given us an example that is from California. So it's kind of, it's pretty expensive. So they've done 3 pharmacies, the Medicine Shop, the Rite Aid Pharmacy, and the mail order. And you can see right off that one that's out of network, you just don't want to, you don't want to go there because those medicines, prescriptions, if you decided to do that, then it would be very expensive. You wouldn't have the cost savings. And how to find a plan-specific preferred pharmacies. You can refine your search to tell you if the pharmacy is preferred, and we encourage everyone to use their in-network preferred pharmacy. Go to the next slide. And it states there in the red box that as opposed to your out-of-network or your in-network. And then the pharmacies, you can change if you choose and put in another one to see how that will work out. And you just play with it and just keep moving it around to where you can get the best prices for your medications using, of course, your in-network preferred pharmacies. And the next slide. The mail order. How do pharmacy networks affect what you pay? And it's a great deal on how they affect what you pay. So you want to always include 5 pharmacies to get the best idea of what it's going to cost you. Preferred in-network, out-of-network, and mail order. So we'll go to the next slide. And you can you can filter to show, and this is one of the great tools in this plan finder, is that you can refine your search. And so when you're entering more than one pharmacy, make sure to look at the plan details and to see what costs are under each pharmacy, which is so important. And you can sometimes, if one of your prescriptions is cheaper at one preferred pharmacy as opposed to another, use that. It's your choice. And the next slide. So we've had the examples again of the medicine shop, the Rite Aid pharmacy, and the mail order. And you can see the differences with that. It's pretty self-evident. So we'll go to the next slide. And you can see again the medications that you would pay for in August, September, and the mail order. It's a big difference. So we'll go to the next slide. And of course, this is a little pearl of wisdom they've dropped. So you can see just quite clearly what the medicine shop, Rite Aid pharmacy, and the mail order. Drug cost in different phases of Part D benefit. So you can see that those are important to take a look at for each medication that you take. And then we'll go to the next slide. And then right there, it'll show the medicine shop and the Rite Aid pharmacy. I know I get excited about learning helping people find the pharmacy that's going to save them the most out of pocket. And I think they get excited too. So we'll go to the next slide. And you can see there that it's different, the costs via the pharmacy type. And we'll go to the next slide. And you can again use the filters. The filters are absolutely wonderful to use. And it'll show you what you need to look at. And you can filter just as you were on Amazon shopping for shoes. You only want to look at brown shoes, and they'll bring up all brown shoes. But this is an excellent tool, and it's getting so much better. And we'll talk about next the drug restrictions. There are quantity limits on, and you have to check with the plan, quantity limits on how much medicine you can get at a time. So when you're looking at your plan, we also want to look at that if there are limits on how much you can get at one time. Maybe 30, maybe 60, 90 days. So they often will tell you if you have, as the example they've shown, the albuterol has quantity limits on that. Yes, the quantity limits and the frequency. And that's something you could talk with your doctor about. Restrictions such as prior authorizations and step therapy, and we'll talk about that more in the coming up slides about some of those areas that you need to look at when choosing a plan. Such as, again, prior authorization and step therapy. And we'll talk a little bit more about that. We'll go to the next slide. Again, you check to see if there's restrictions that affect the patient, and make sure you contact the plan or check out the plan's website. And that's the one that comes up, Blue Shield RX Enhanced. And you just want to make sure that they have no restrictions or prior authorizations. And we'll go to the next slide. And that's another pearl. Okay. And utilization management tools, plan restrictions. And again, we'll go more deeply into prior authorization for the prescription drug plans. To be certain that drugs are prescribed and used correctly, plans have certain rules, and there are ways to plan and manage. Plans can manage access to the covered drugs on their formularies. All three are listed here on the slide are on the plan finder, but the exact details are only available through the plan. So prior authorization, if a patient's physician needs to contact the plan and establish that a drug is medically necessary for the patient, and prior approval is required from the plan before it will cover certain medications. So you want to make sure, and of course you're having that frank, open, honest conversation with your doctor about your needs, and that way you can work through some of that if there are prior authorization required by your plan. So we'll go to the next slide. Utilization management tools. Again, call the plan about your prescription drug plan or visit the website and to educate yourself about the specific requirements that they might have. And often it can be resolved at the point of sale, but just to be on the safe side, always make sure that you understand if a doctor prescribes something, it must be medically necessary for your plan if you need prior authorization. Okay. And let's see, we have the next slide. And I apologize, I cannot pronounce the name of that drug. So it's indicated to treat adults with depression, major depression disorder. So we'll see if it's an expensive drug that needs it states prior authorization for that prescription. We'll go to the next slide. And I can't pronounce that one either, but there are three listed. I don't know I can't pronounce that either, but these are some of the examples that they're using for prior authorization. We'll go to the next slide, which is, again, another part of the utilization management tool used by plans, the step therapy. For instance, some plans require that you first try a generic drug, if available, then a less expensive brand name drug, or before that's all taken place, before you can get the brand name drug on the list, and which is more expensive. But however, if your doctor believes that because of your medical condition, it's necessary for you to have that, again, medically necessary for you to have the more expensive drugs, then you have to try, the step therapy without getting the most expensive drug first. Your prescriber can ask for an exception if he or she believes that it would adversely affect your health if you take the less expensive drug. If your prescriber, your doctor, believes that the less expensive drug would be less effective, your prescriber, your doctor can give a statement supporting that is medically necessary. So just be aware that this might come up, the step therapy, and make sure, and if that's something that you do not want in a plan, uh, you have other options. That's what's so good about the Plan Finder. We'll go to the next slide. And it just shows a little example, but we'll keep moving on. And yes, that's still completing the example they're showing about Miss Dr. Smith prescribing an ACE inhibitor. So we'll go to the next slide. And then again, it's telling us more about medical condition that's treated with the step therapy. And so you'll have a chance to look over that. And we'll go to the next slide. How are we doing on time, Melinda?
We're doing good. We have about 19 minutes left total.
Okay. All righty. Well, I'll speed it up a little bit. Thank you, Marty. So the step therapy, we've kind of gone through that, and we'll just keep moving on. Don't want to run out of time. And I still have slides left. There's that prescription that I cannot pronounce. For this is stating the step therapy that we just went through. And
Sorry,
we'll just go.
I'm on quantity limits.
Okay.
Yeah.
I'm sorry.
No, that's fine.
Okay. So there's another prescription that I cannot pronounce. So quantity limits. There's quantity limits restrictions. The plan can outline more details than that we have available to us now. But for safety and cost reasons, again, the plan may limit the amount of prescription drugs they cover over a certain time period. So you will want to look at that if that is important to you. Your prescriber believes that because of your medical condition, the quantity limit isn't medically appropriate. And this is where you involve your doctor. And your doctor believes that you need a higher dosage of 2 tablets per day, then you can talk with the plan. The doctor can talk with the plan. So we'll go to the next slide. Utilization management tools and quantity limits on these prescriptions are drug tiers and quantity limits. So you'll want to, again, take a look at that if that is something that is important with your medications that you take, quantity limits, and the drug tiers. And this is a little example of, this is your drug list and how you, again, if you have the personalized search and you're on your Medicare account, you can change, and it's the next slide, you can change your drugs, you can edit it, you can add or delete, and it will save it for you. And that way, when you pull up your Medicare.gov website, all of your prescriptions will be available to you. And the frequency and the whole 9 yards, and I think you'll really like it. Go to the next slide. And there are the star ratings. And just one example, the customer service, which is has 5 stars. If customer service is important to you, this is the tool you'll need to use to get that information. Customer service is important, but the number of member complaints that might give you pause or hesitation, or the drug safety and accuracy in drug pricing, that's something you might want to look at. So there's a lot of information on there. And then we'll go on to Medicare Advantage plans. Of course, you know that you can get your Medicare either through Original, which is traditional Medicare, or the Medicare Advantage plans. And we'll take a look at them. They're similar, but there are a few different things about the Medicare Advantage plans. And we'll go through these pretty quickly. The Medicare Advantage plans are available in your area by your zip code. And they'll state, as you can see in the red box, how many plans are available. And you can also use those filters, which are absolutely wonderful, and selecting a plan type. And you just hit that drop down little arrow and it'll give you the information available to you. So please use the filters. And then we'll go to the next one. And there's more filters. And it's absolutely lovely that you can do it by plan benefits, insurance carrier. If you have a favorite one you've used, especially if you are retired and you had Blue Cross Blue Shield at your job, you might want to take a look at it. But you can always switch it back and look at something else. So it's a really good tool. And plan filters, you can use it for the star ratings, the plan type, the benefit coverage. Oh, there's a vast array that you can use the filters for. So we'll just go through those. And that's, again, if you want star ratings, plan type, plan benefits, drug coverage, it's all there for you to choose what you want. And the star ratings, select a plan type, whether you want an HMO, a PPO, prescription drug plans, you can click on apply and it'll take care of that for you. And then the special needs, you can view that, or you can apply if that's something that you want. Okay. I think we're zooming through these. And the Medicare plan, a Medicare Advantage plan costs. And it just gives you a quick overview of the plans, and really pay very close attention to if it has a monthly premium. And it'll outline that to you and tell you it does not include the Part B premium. And it'll also list your total drug and premium costs for the year, your health deductible, your drug deductible, and in-network. And then on the right-hand side, it'll show all the plan benefits, and we'll go through those pretty quickly. And I just said that monthly premiums, so we'll keep going. And your maximum out-of-pocket spending limit, and we'll just touch on that just for a little bit. You have an annual maximum out-of-pocket spending limit or maximum out-of-pocket limit out-of-pocket for Part A and Part B services. Once you reach this limit, you'll pay nothing for covered services. And it differs between plans. So if that's something that is you want to be on the lookout for, and that's something that is important to you, again, this is out-of-pocket maximum or out of pocket, and you can't be sold enrolled if you don't need. I'm sorry, if you need one, but you want to make sure that you are lowering your costs, and I think that's the goal, is to lower your cost, and it's very important to do that. So we'll go to the next slide. There's a pearl. Okay. So we'll go to the next slide. Again, we kind of talked about this, the maximum out-of-pocket examples. And you want to be aware of that, what you spend in network. And if you decide to go in and out of network, you can do that also, but you'll pay a little bit more. Whoops. Okay. And we'll go to the next slide, which is the Medicare Advantage Plan overview. And on this blue bar for this Scan Classic HMO, you'll see that your costs for your monthly premium zero, your zero health deductible, and visiting your primary doctor is a zero copay, and your estimated total drug costs. And again, that's for that list that we viewed earlier. Your monthly premium, your health premium, your drug premium, and just take a look at that and make sure that's something that is agreeable to you. Go to the next one. And also, just words of wisdom that make sure if you choose a Medicare Advantage plan, that the doctors that you want to see are in the plan that you choose. You can have a wonderful plan, but if your doctor that you like and you've been going to for a number of years does not accept that, then it doesn't do you any good. So always call your providers to make sure they take the plan that you're choosing. And so we'll go to the next slide. And it tells it again, this is a pearl. Your doctors, you want to make sure your doctors accept this plan that you choose. Okay, we'll go to the next slide. And so Medicare Advantage plans has some services, benefits and services. They have, of course, they're showing on this slide, mental health services and outpatient group therapy with a psychiatrist is $10. But make sure they're showing that there are limits that apply. So make sure you click on that drop down arrow to see what the limits apply. And we're back, the pharmacy and that medicine shop and the Rite Aid pharmacy and the mail order. And it'll show you that yearly cost on the next slide of what you would spend. So I personally would not set foot in the medicine shop. I would make my choice between the Rite Aid and the mail order. So again, it's the bottom line is your pocket, what's in your pocket. And it's left up to you. We'll go to the next slide. And Medicare Advantage plans have some other benefits such as dental, vision, and hearing. And you can just see what services, what specific services that are covered and what appeals to you and what your needs are. Next, and there's another star. Just check out the plan's extra benefits. It's a list of what's available, and it's left up to you to make that choice of what you want. Sometimes all these are bundled in there, but there might be some extra ones that you might want to pay for. You just talk to or go talk to someone at the plan or go on the website to see what they have. And then where's the star ratings? And again, that's just a summary of the star ratings. Customer service, that's important. Staying healthy. Sometimes the Medicare Advantage plans give you a little extra for exercising, going to the gym, getting your checkups on time. So that's something you might want to look at. Okay, go to the next one. And the health plans. It's all very good information to have. And so we're at the plan comparisons to original Medicare. And of course, their original Medicare and this plan's rating, which is the Medicare Advantage plan. And if the stars are important to you, the ease of getting needed care and seeing specialists, this has star ratings. Health plans provide information or help when members need it. The PLIS plan's ratings is 5 stars. So just looking over some of those details, if that's important to you, then of course you need to choose what is important and what is going to be a benefit to you and your health and your wallet. So we'll go to the next slide for the personalized plan search. And the personalized plan search, you must create you don't have to, of course, I'm not saying you have to, but for the personalized plan search, you'll have to have a Medicare.gov account. And so just some of the information that's needed, you'll have to create a username and a password, provide your Medicare ID number, date of birth, a zip code, and you can add your medication list, the dosage and the frequency and the quantity. And it's pretty easy, but that personalized search, you can come back to it, add a drug to see how much it'll cost you with the plan. If the doctor prescribes you something in the middle of the year, and you can just check and see how much it is. And we'll go to the next slide for the landing page for the Medicare.gov. And it's so important to use this tool. Of course, you can always call us or you can call Medicare. But this really is a wonderful website to use. We'll go to the next slide where you put in your zip code. And again, we strongly suggest, you don't have to, but we strongly suggest that you start an account, create an account if you have not done so already. It's just really easy to just log in and get all your information. And they keep it very secure. So, because if you try to go into your account, I think it's 2 times, then it'll lock you out. So it's protecting you also. So it does a current plan and subsidy status. So if you receive extra help, sorry, the next slide, then it'll be able to tell you what your plan is going to cover. And then the next slide. Yes, extra help with your drug costs. It'll factor that in for you. Go to the next slide. And then your pharmacy list. And you've saved this showing that they've served 1, but we always suggest that you just don't stop at 1, choose up to 5. And it also, this, of course, if you are using your own account, you've created an account, this data will be safe for you. And you won't have to go back and input your prescriptions. Go to the next slide. and it'll save that for you. It's really an excellent tool to use. It flows really good. You can come back. Don't worry about, if you put something in wrong, you can come back and just go back and take that information out or add the new information uh, as you see fit. And it'll save on your prescription drugs. And it'll show you what you've recently had filled. So it's a great tool. I can't say that enough. And it'll ask you if you're ready to shop for plans when you're looking at it. A current plan is shown during a personalized search using the Medicare.gov, using your Medicare.gov account. And then we'll go to the current plan. And we see that your current plan for this person is the WellCare Classic prescription drug plan. And it has zero cost for drug coverage and zero cost for the retail pharmacy. And if that's not good news to someone, I'm sure it must be. So we'll go to the next slide. And we're still on the personalized search. And all this is available with a Medicare.gov account that you created. So it's really a very useful tool to have when you are during open enrollment. Again, you can always call us or call Medicare or the plan, and we'll go to the next slide. Oh, this showing some of the advantages. Of course, the current plan and your subsidy status and your claims data, I'm sorry, and your updated drug list. It's all right there and it's available on your personalized Medicare.gov account and your preferred pharmacies.
Felicia, I'm not sure exactly how many slides do you know how many slides you have left?
I have 4.
4. Okay. I'm gonna let you go ahead and finish, and then we'll do our thing.
I know we're getting close. I'm sorry.
We're just over time, but that's great. It's no problem at all. Go ahead.
All righty. Well, we're finishing up. I hope that everyone is enjoying this. I get excited about the Plan Finder, and this is another pearl of wisdom. So you have choices. So you need to do an annual checkup of your plan that you have and make sure the monthly premiums, the deductibles, the cost sharing, co-insurance, co-pays, formulas, all that is there. Watch out for drug restrictions, prior authorization, step therapy, quantity limits, and your pharmacy's network. Always try to use your in-network preferred pharmacy. Okay, and of course, again, everyone should re-examine their Medicare Part D plan. And just one key takeaway, 75% of people are paying more than they have to for their Part D drugs if they would take a look and just kind of go over it and make sure you're getting all that cost savings. Okay. And we know if you don't do that, you continue to pay more for your prescriptions. So we're wrapping up.
Why don't you, if we could go back one slide.
Sure. Which one?
We'll go back just one.
Okay.
Oh, no, I thought, did we not already hit the, I'm sorry. I thought you already hit. I saw the CU one, but did you have something to say before that real quick? I was going to go ahead and cover the CU stuff for people that have to get off.
Okay,
and then
well,
if you guys are interested in staying on and answering questions, that would be great.
Sure.
Okay.
Okay.
So real quick, I know we're just past, I've got 11:35. So for those of you that really have other obligations, I want to go over the CEUs one more time. today we are offering complimentary CEUs for licensed social workers and licensed professional counselors in the state of Texas. We're also offering certificates of attendance. And please note the rules or guidelines for each of them are the same. Today's webinar is worth 1.5 hours CEU credits. You must have completed the entire webinar live and the Q&A. Now, I understand if you have to go past the 11:30 point that you've accomplished what you need to accomplish if you have to go. Okay, you must also complete the Google survey evaluation. It should give you a chance to go there as you close out of Zoom this morning. But if it doesn't, you'll receive that also in a follow-up email from me tomorrow. The Google evaluation survey will be available for you until 1 week from tomorrow. At that point, it closes, and give us about 4 weeks after that to get those certificates with you. Please note, about 4 weeks after the certificate closes, or the Google survey closes. But go ahead. I'm going to let you guys address questions.
Sure.
And I'll just say thank you all for joining us. We certainly appreciate it. But go ahead. I'll let you address
Thank
questions.
you. Thank you.
Yes, this was a lot of information.
Yes.
It's good that the slides will be provided to all participants so that if you do have questions, you can refer back to the slides. But of course, we are available to also answer questions. You have our phone number, you have our email, you have the email and phone number for the SHIP if you're not in our area, for Angel with Texas Senior Medicare Patrol. They cover the whole state of Texas. So you just call them for everything. No. But I've tried to answer some questions through the chat. Okay. I think I got to most of them, but I'm going to, there was one that I missed. Is a plan already in place after you start receiving Medicare benefits, or is the plan done when you apply for Social Security benefits? When you enroll in Medicare, that's usually just parts A and or B. So in order to get prescription drug coverage, you have to actively enroll. Otherwise, you do not have prescription drug coverage, and you could be subjected to a penalty if you don't enroll when you're first eligible. If you decide to go with an Advantage plan, you would have to actively enroll, and you would need Part A and B to enroll in an Advantage plan. What if a drug is not on the list in the plan finder? What did we say about that, Felicia?
If it's not in the plan finder, maybe there's a generic portion. It should come up on the plan finder, but if it's not there, check with your doctor to make sure that that's spelled correctly, because I find that most of the drugs are available in the plan finder. Yeah. And sometimes, like we experienced the other day, if it's spelt wrong, then it's not going to show up.
Right. Now, just one other thing, one other reason it may not come up is if it's a compound drug.
Yes.
We have found that those do not show up. So if you are typing it in, for instance, if you don't know the spelling, you can actually go to Google, and if you put in a wrong spelling and say prescription, it'll give you the right spelling. If it is right and it's still not coming up, then I would suggest checking with your doctor to see if there's an alternative so that, you're able to get the medication that's needed.
Yeah, I didn't think about Google. That's brilliant, Melinda. I didn't think about Google.
That's how I got the other one the other day.
I didn't think about Ask Google.
Let's see.
Yes.
Okay, I answered that. The plan finder is available all year long, so you can do a search at any time. If you do a search Next year, up until October 15th, sometime the 1st through the 15th, it's only going to show plans for that current year. If you do a comparison after October 1st-ish, then it'll show plans for the current year and for next year. So, because they're getting ready for open enrollment. And we got a lot of thank yous and that it was helpful, good information. Okay, Linda. Okay, you're talking about drugs. What about original Medicare health plan? I was told when you exit Medicare health plan, you can't return. The annual enrollment period is for prescription drug coverage, which you can get through a Part D standalone prescription drug plan or a Medicare Advantage plan. So October 15th through December 7th, you can always go to a Medicare Advantage plan. And there are other times during the year, such as special enrollment periods, the Medicare Advantage plan, open enrollment period. So you can always go to an Advantage plan. There is no application or underwriting or anything like that for Advantage plans. Medigap policies are different and they don't have an annual open enrollment period. So those are two different things. But health plans, usually that's speaking of a Medicare Advantage plan, you can go back to those each year if you choose. Okay, that's all the questions. Who do you contact first if you believe you have been scammed? Angel.
He's gonna regret she didn't stay on here. But both of the contacts will be in the follow-up email that I send out to you all. So you'll have both of them. And but yes, I mean, obviously, I mean, if you have been scammed, surely Angel's the one, or you feel like you've been scammed, she would be the one to call. If you need help with open enrollment, you would call Melinda and Felicia. So, yes. I think that's is that a good breakdown?
Sounds good.
Okay. Well, thank you, Melinda. Thank you, Felicia. Thank you so much.
Thank you.
And I'll say thank you to, I'll just say thank you to Angel so it's on the recording so she knows after. Okay. Thank you all for joining us so much. And everybody have a wonderful day.
You too. Bye-bye.
Thank you. Bye-bye. Bye-bye.